Hello there. My name is Dan Chisholm, coming from WHO, where I work as a mental health specialist. And I'd like to thank the organizers for the invitation to join this global health talk. And just sorry I cannot be there in person. Instead, I'm recording this short video with a view to providing you with a few insights on the subject of mental health and its relevance to the upcoming high-level meeting of the UN General Assembly on NCDs and mental health, which will be taking place after the summer in September in New York. This is actually the fourth meeting since 2011 that's dedicated to NCDs, but perhaps the first to really or fully incorporate mental health within the preparatory process and the expected political declaration arising from it. So as such, this is a really important opportunity and meeting for those working in the global mental health field to galvanize some commitment, investment, cooperation, and enhanced action on mental health as well as NCDs. Now, I mean, of course, a primary reason for holding this and earlier high-level meetings on NCDs is to bring attention to the huge contribution they make to global disease burden and the threat or the risk that poses not only to health system resilience and universal health coverage, but also, in fact, to broader economic prosperity, human capital development. So, I mean, for NCDs, it's you I'm sure know that, I mean, the leading cause of deaths, around over nearly 2/3 of all deaths due to conditions such as CVD, cancer, chronic respiratory diseases, and diabetes. And they make up around seven of the world's top 10 causes of death. Now, I mean, why is mental health being incorporated into this upcoming high-level meeting? I think that's really down to growing evidence and growing international concern about the public health and socioeconomic impact of these mental health conditions and neurological conditions. That's partly down to the COVID pandemic, which, of course, led to a huge and rapid rise in rates of depression and anxiety, but also revealed the weakness and the vulnerability of most countries' mental health services and systems. And of course, mental health does represent an intrinsic and part of overall health and well-being, but only a small, sometimes tiny fraction of the 1 billion people worldwide with a mental health condition actually are receiving appropriate treatment and care. And due to their high levels of prevalence, the high level of unmet need, and the high level of disability, these conditions end up accounting for a large proportion of years lived with disability, so-called YLDs, around 1 in 6 of those globally. And of course, on the mortality side is also suicide deaths, of which there are around 700,000 per year. Now, the way things are going, I mean, current lifestyles and the projected shifts in both the size and the structure of populations really indicate that these numbers are only going to go up in the future. And that's a real issue, not just for health and well-being and the health services that are tasked with taking care of these conditions, but also to societies and economies as a whole, because of the huge expected losses in human capital and capacities. Millions of households already impoverished each year by lost earning opportunities and out-of-pocket spending on health services and products, drugs and medication things. While estimates, studies have been done which show that trillions of dollars of global economic output are forgone each year as a result of lost productivity. So I think it's important to emphasize that when it comes to mental health and NCDs, there is what we could call a shared but differentiated agenda. The shared agenda includes things like promotion, preventive efforts that focus on underlying shared risk factors, lifestyle interventions to encourage physical activity, improve and enhance mental health and well-being, while also having more integrated services at community and general health care levels can massively increase access to care and improve adherence to treatment. Sustainable financing is another shared concern and agenda item for these conditions. And we had a successful meeting about a year ago with the WHO and the World Bank on sustainable financing for these conditions. But there are also a couple of quite sort of specific mental health issues that are not part of the NCD mainstream, let's say, but which do require urgent attention and consideration by the member states in their preparations for this upcoming meeting. And draw your attention just to three, then I'll stop. The first is around child and youth mental health. This is a huge agenda, a huge concern. Up to 1 in 5 young people experience mental health conditions, and these largely go unrecognized and untreated. So there are several actions that can and should be taken to address this, starting with including school-based interventions like social emotional learning programs, addressing violence in the community or even in homes, bullying, substance use issues, and of course some aspects of technology and social media as well. Another area is suicide, which is one of the mental health related SDG goals, and it is a leading cause of death amongst in younger people between, for example, 15 and 29-year-olds. And there are roughly 20 or so countries where suicide is still criminalized. So a specific request is for countries to decriminalize suicide where that's still the case, and to ramp up efforts to prevent suicide through various evidence-based approaches, including banning of hazardous pesticides. A third area would be around the kind of services and how to make those services for people with mental and other related conditions more rights-based, more person-centered, and more community orientated. Right now, a lot of the services and a lot of the resources go into institutional care. I would like to suggest that many countries can radically alter the configuration of their services towards community level services, integration of mental health into primary care and into district general hospitals where needed. So these are three standout kind of concerns and areas of attention that we hope to see being highlighted and acted upon in the run-up and follow-up to the high-level meeting. So with that, I'll leave you and wish you all a good ongoing meeting. Thank you very much for your attention. Bye-bye.